So after Mr. Silva was injured, he was taken to the emergency room, and he actually had surgery that day. His surgery is described as emergent. Typically, unless the bone's actually sticking out of the skin, it's an urgent operation, something that you need to take care of within the next day or so, but it's not necessarily an emergency. So the operation he had, once again, was he had a nail that was put in, and he has some locking screws down near his ankle and some locking screws up near his tibia. Once that's in place, the bone is lined up, and it typically is going to take a tibia somewhere in the neighborhood of between 7 and 12 weeks to actually heal. Now, when a bone heals, it heals, but it still goes through a process which is called remodeling. And remodeling is where the bone is kind of healed, but it's disorganized. And over time, the bone will remodel itself so that all of its strength goes in the correct direction. So even though his bone will probably be healed because he's a healthy individual who has excellent blood supply, he doesn't smoke, and those are all the bad things. You know, if you're unhealthy or you smoke, those things delay fracture healing. But in his particular case, even though the bone will be healed, it's going to remodel for anywhere up from 6 months to an entire year. So it'll probably take between 6 months to an entire year for the bone to achieve its ultimate final strength that it's going to have. Now, the nail itself can stay in forever. You don't ever actually have to take it out. Sometimes people will have problems with the screws that go across it. Now, the screws are underneath the skin, but sometimes they push on the skin and it can be a bothersome person. But most people who have a titanium nail put into their tibia, it stays in forever and you don't ever have to take it out. One of the things I've heard people talk about is, well, he's lucky because the bone will be stronger after the fracture, and that's just simply not an accurate statement. Sometimes it is. The bone can be much thicker in that area, and sometimes the bone actually is thicker. And sometimes when we see refractures, we see fractures that happen away. But sometimes the bone is actually weaker in that spot, even though it's completely healed. So you wouldn't say for sure it's going to be stronger. It may be stronger, it might be weaker, but I certainly wouldn't think of it as foolproof and never going to happen again.